Hey guys, Dr. Connor LaVallie here with Greater Good Chiropractic here at 240 West River Drive in St. Charles, Illinois. Now, I'm just going to take some time and talk to you a little bit about this unprecedented situation we have going on with the coronavirus. Just so you know, we're seeing patients. We are still open. We're going to be taking care of you on a regular basis during our normal office hours. Because we know through research it's been shown that chiropractic care improves immunity, improves neurological function, improves adaptation, which allows your body to fight infection, to stave off illness, which is why we've been deemed sort of an essential health care provider during this time. So number one, we're open. We're going to keep things very tidy in here using the sanitation wipes that actually have on their label here. I could show you coronavirus. They actually kill it, as well as H1N1 and some of these other issues going on. That's the only reason we're staying open, is because we're actually going to take a focused look at that. We're also going to be spacing out patients so that we see about one person every 15 to 20 minutes, so that you're only one in the office, so that we can get you taken care of right there and then get you on your way. Now, another thing we've been getting a lot of questions about in regards to the coronavirus is, how does this compare to influenza? Isn't it just the flu? Why are we creating all this mass hysteria? Why are we shutting down businesses? Why is the government freaking out? Well, it's a little bit different. I actually agree with the CDC and the World Health Organization's viewpoints as creating some social isolation in terms of not getting big groups together, because this coronavirus, the CoV-2, which is the virus itself, and the COVID-19, the illness, are sort of not fully understood because of how quickly this has come on. What we can say is that the influenza virus, H1N1 and others, they really cause a complete immunodestruction. So where they'll go in and attack the immune system and really have the patient feeling completely shut down, really high fever, chills, cough, respiratory distress. And that's because it's having a big direct effect on the immune system. We've all sort of experienced it if you've been around it long enough. The problem is that with the coronavirus, specifically the CoV-2, is that we know that it affects a certain type of receptor within certain areas of the body. So within the lung tissue, you've been hearing, if you've had respiratory distress, to go seek care right away. That's because in the lung tissue, in the heart tissue, and the gastrointestinal system, there are these cells called ACE2 receptors, which are responsible for producing pneumocytes, specifically the pneumocyte type 2, which is responsible for producing a very essential molecule called surfactant, which creates a situation to where the alveolar sacs can open. They can do their job. It reduces surface tension on the alveolar sacs and allows you to breathe appropriately. So when the ACE2 receptors affect the pneumocytes, when enough of them happen, that's what creates the major problem in the symptoms, which we haven't had a specific virus like this before come about this way. So what we want to do is buy some time and allow the experts here to really figure things out. And admittedly, I am not an expert in infectious diseases, but what we do know is that we can do the right things within our power to make the right decisions in order to bolster our immune system. And what does that include? Of course, whole foods, nutrient-dense, micronutrient-dense foods like spinach, kale, garlic, anything with really bright color can help bolster the immune system. Intense exercise that's done in a way that you enjoy is going to bolster the immune system, increase that adaptation, and allow the entire body to start to function at a more optimal level. We can also reduce our stress, and that's the big thing here. The main adversary here is that chronic stress, that incessant sort of knowing that this thing is out there to get me, and if I come in within less than 6 feet of somebody, I might get that virus. And what we can do specifically and first and foremost is take care of those things that we can control, which is the nutrition, which is the exercise, which is the stress modification, just taking a few deep breaths. I think we need to be role models at this time, not just for our children, but for our patients if you are in healthcare, which happens to be that class of citizens that are forced to go work, because we need you now more than ever, and that is a fact. I'm just going to read you a little bit of a post here from somebody that I follow, Brandon Bouchard. He said, "You can show your family that in times of chaos, you retreat into distraction and entertainment, or you choose to skill up, to learn, to deepen relationships, to progress rather than pause or hide or hunker down onto the couch all day. please, you still have goals and dreams, and they are all watching.